and welcome to this NAMI Racine County Legislative Forum on Mental Health Issues. We're pleased to have with us this evening candidates for the 64th Assembly District, including the incumbent Tip McGuire, as well as Ed Hipsch, who is also running for a 2-year term in this district. We're excited to have both gentlemen with us this evening and appreciate their time. Our basic format will be to give each candidate an opportunity for up to a 3-minute introduction, tell us about themselves, perhaps why they're running for this seat, and perhaps their connection with mental health issues. And then our advocacy committee has prepared a series of questions for the candidates. We'll pose those questions and give each up to 2 minutes to respond. And then we'll conclude by giving each candidate some time for some closing comments. I should mention that I'm Patrick Bohan, the president of the board of directors of the National Alliance on Mental Illness of Racine County, and also chair of the advocacy committee that prepared the questions we'll be posing this evening. So we'll start and we're going to kind of alternate order as we go throughout this. We'll start with Representative McGuire on our first segment with some opening remarks, and then we'll ask Mr. Hipsch to follow with his opening remarks. Representative McGuire.
Well, thank you, Pat, and thank you for organizing this event and having this. I think it's incredibly important that we talk about issues of mental illness in our communities and how to best treat them and how to best manage them. I'll tell you, so we're concluding my second term in the assembly, but before I ran for office, I was an assistant district attorney. I was a prosecutor. And I observed a tremendous amount of folks who were entering our courthouse who had, undiagnosed mental illnesses or were struggling, certainly with those challenges. And it spurred me to get involved. So I was on the board of the Kenosha NAMI for a while before I ran for office, and it's certainly an issue that I remain very passionate about handling. I think one of the important things to note in this conversation about this is that we've been making good ground in financing some of the programming that we'd like to see to assist folks with mental illness and people experiencing those challenges. But there's certainly more to be done. And in fact, Governor Evers certainly pushed for more in his last budget. While unfortunately legislative Republicans didn't go along, I'm hopeful that this session we can find broad bipartisan consensus that investing in more money for student mental health, which is something the governor put, I think, $53.5 million in his budget proposal. He allocated towards that, which Republicans brought down to $19 million. That would be something that I'm hoping that we can see much more of an investment in, as well as other certainly ways that we can make the workforce for mental health more accessible and more easy to get into. So I think there are a lot of exciting things that we can accomplish coming up. And I think there are a lot of good things that have been happening that have been moving us in the right direction, but there's certainly still more to be done.
Thank you, Mr. McGuire. Mr. Hipsch, opening remarks.
Sure. Thank you for putting this together. I appreciate it. And thank you to all your members. I'm running for the seat for the 64th Assembly District. And I'm running primarily because I've always wanted to get involved. I'm never been one of those people who complains about the way things are and just sits idly by and does nothing. I've run for other local seats, and currently I'm running for this seat, basically because I do have a penchant for getting involved in helping people. So I currently run my own limo business. That's why I'm calling from my car. I'm part way to O'Hare. I'm gonna need to go pick somebody up as soon as we're finished here. But this worked out okay. I was able to pull over and chat. So by way of education, my background is actually in psychology. I've got a bachelor's in psychology, and I did a lot of master's work, but did not earn a master's degree. But I took a lot of psychology courses. I learned a lot about mental health along the way. My interests waned towards the experimental and statistical side of things. And that's where I actually built a career working for a market research firm first, and then for an employee research, actually for an HR consulting firm in the employee research group that did employee surveys. So I've worked kind of around issues of psychology by way of my background. And currently, this job, I'm running my own limo business in Kenosha and Racine.
Very good. Thank you, Mr. Hipsch. appreciate those opening remarks. So, and we'll give you the opportunity to answer this question first, followed by Representative McGuire. And I apologize, this question is a little longer, but it does relate to mental health crisis services. So the national launch of the 988 suicide and crisis lifeline in July highlights the need for every community to have a comprehensive mental health crisis response system. The National Alliance on Mental Illness, of which we are an affiliate, identifies three key pillars of an effective crisis care system. One, 24/7 crisis call centers staffed by trained professionals. Two, mobile crisis teams that include mental health professionals and certified peer specialists. And three, accessible and widely available community-based stabilization programs and facilities. So our question is, what is your view of the role of the state legislature in ensuring that comprehensive mental health crisis care is accessible and available when needed in Racine County and throughout Wisconsin, representing that both you gentlemen are running for a seat that represents both Racine and Kenosha County. Mr. Hips, would you take that question first, please?
Sure. I believe all three of those pillars are vitally important for mental health crises management. And without them, we're really struggling to catch up. That is, to me, that is our first line defense. The 911 or the emergency system is key to this whole thing, and getting the services to back it are very, very important. So I would see the role of the assembly to fully support that, to support it on an ongoing basis. Perhaps do some evaluation, make sure everything is working as it should. And again, that comes back to my research background. I believe every program should be evaluated for its effectiveness, and if it needs to be retooled and reworked to get better results, we should certainly do that. But I think we should definitely support it. We should continue to fund it and do anything that we can in our ability to keep it as a vital system that's in place now.
Thank you. Representative McGuire?
Thank you. So I agree. I think, first of all, the 988 number was a tremendous accomplishment and is something that hopefully will be saving a lot of lives across this country. And so I was very pleased to see that happen. One of the things that I see, so we began a bit of an investment this year, and this is sort of what I mean that there's more that we can do. We began a bit of an investment in the mobile crisis teams with the passage of AB 333, which I was pleased to support, which provided funding for mobile crisis response units in rural communities. The governor had actually allocated an additional $1 million to that experiment and that program in his budget, which had been removed. But and we attempted to bring that back with an amendment. But I think it was a good first step. And I'll also tell you, Pat, in my conversation with law enforcement when I've done ride-alongs in both Racine and Kenosha, this is something that, you know, a lot of the law enforcement members on the ground are really supporting as well, simply because, you know, even though, you know, in the Kenosha NAMI, I know we did crisis intervention training with law enforcement officers, and I think we graduated over 500 locally here in Kenosha County. I guess I don't know whether you've been able to have the same success up in Racine. But even with that, I think law enforcement recognize that they have a specific duty and that they have specific responsibilities, and that oftentimes they're placed in a position that they aren't fully trained for, and that hopefully we can have people who are better trained in those circumstances to surround them, and that will also help assist our members of law enforcement in having more of a safe environment. And then I noticed that you said accessible and widely available community-based stabilization programs and facilities. I think that's something hopefully that we can get a dedicated facility or dedicated space and beds down in southeastern Wisconsin. I know it's been sorely lacking for a long time. And in fact, it pulls a lot of our law enforcement members off duty when they have to transport people significant distances, and it costs a lot of additional funds. And so I think having something here is something that we continue to work towards, and I think would benefit the community quite a bit.
Thank you very much. Before we go to the next question, just to follow up on Representative McGuire's comment, we're actually conducting CAT training in Racine County this week. So,
oh, that's great.
It's interesting you mentioned that.
It's a great program, and everyone that I know who's gone through it has really felt very pleased and feels like it was a beneficial program for them.
Very good. So we're going to switch now to the mental health workforce, and Representative McGuire, you'll go first on this question. And it's actually 3 questions in a question, so bear with me for just a moment. What role can the state legislature play in addressing the current shortage of mental health professionals in Racine, Kenosha County, and Wisconsin? Do you have specific proposals to develop and expand the mental health workforce? And finally, what is your view on the role of telehealth in the delivery of essential mental health services?
Great question. So let me start here. The role that the legislature can play in addressing the shortage of mental health professionals, obviously we can dedicate more money to help assist with managing, there's a workforce shortage in almost every field, and we want to make sure that people see the attraction of joining this workforce. And so I think that's certainly something that the legislature can play a role in helping counties deal with some of those costs and helping to attract workforce there. But one of the ways that I've personally been working on it, and that we've attempted to make some inroads over the past 2 years, was on the second question. To develop and expand the mental health workforce is, first of all, the Department of Safety and Professional Services. I know Governor Evers had attempted to increase their budget so they could move licensure through a lot quicker for a lot of people, since that we've been seeing quite a slowdown there. And that has been part of his budget earlier this year. Now, unfortunately, legislative Republicans didn't allocate that funds directly to DSPS as they had requested, and so that couldn't be done. But a second step on the second side of it, and in my conversations with mental health professionals, is actually how I learned about this problem. There's something called insurance credentialing, and this goes across the medical field as a whole, but especially impacts small medical providers, is that there's a lag time from when mental health providers are applying for insurance credentialing, which is to say that to make sure that their provider, the individual counselor or other, is credentialed by the insurance so that they can receive payment for it and they can provide the service to the individual who needs it. That there's a massive timeline, up to 4 months at times, for them to simply get credentialed by an insurance company that ultimately ends up credentialing them anyway. And that this lag time is something that we've already been working on finding ways. We've brought in medical providers all across the state and spoken with them about their individual challenges and how it works with their industry to see if this is something that we can ease up or find a way to shorten that timeline. I think that would be one great way of getting more mental health providers through the system and out and able to work and able to treat patients quicker.
Thank you. Mr. Hibsch?
Certainly the worker shortage is an issue in pretty much every industry there is, and it's something we have to deal with, I think, as an ongoing basis from what I'm hearing from people. We need to do something to make these career opportunities more attractive and more accessible for people, and get them into programs that can turn out mental health professionals for counseling and such. As far as the crisis lines, I saw a really good feature on TV about some training for 911 dispatch operators. I think it was at the high school level, actually. They were getting them involved, they're getting them some basic training and finding out that there's a career there that some of these kids never would have even thought of. And I think the same thing would apply for crisis management hotlines as well. It would just be an extension of that. We can get people involved in doing that sort of work. As far as telehealth, I've used telehealth for myself for medical reasons, and I'm very, very happy with it. I think it really solves a lot of access issues for people. And I think it's something that should be fully extended and take advantage of the technology that exists to bring it into more realms like mental health. I think it's a really good fit. And I think it would be a kind of a seamless way to get somebody connected to a counselor online. So I think that would be a big way to really circumvent the worker shortage by making it more accessible for people to do that from home and be the telehealth mental health professional on the other end. Some people can do remotely.
Very good. Thank you. Our next question relates to youth mental health, and Mr. Hibsch will ask you to respond first in this round. Half of all individuals living with a mental health condition experience their first symptoms by age 14, 75% before the age of 24. Suicide is also a leading cause of death for this age group. what specific measures do you support to expand mental health services and supports for children and young adults?
Yeah, I'm not so sure about specific measures, but I am aware that mental health issues do begin at a young age often. And I think we need to do everything we can to get early screening involved and really sort of search for those cases where intervention is required. Again, that's our first line intervention. If we can get kids on the right path early on, I think that'd be a huge benefit.
Very good. Thank you. Representative McGuire.
So like I mentioned earlier, I'm a strong supporter of increased funding for mental health in schools. I see schools as, a place where almost universally most children go. I know that there's some folks who are homeschooled, and I think that there certainly should be some outreach to them to make sure that they have access to whatever services that they need. But the vast majority of children do attend our schools. And so I think it would be a great opportunity and a great place for us to be expanding mental health services so that these children have access to this and know that there's a place where they can find support, as well as make sure that they're getting what they need to be successful. And I'll note again, the governor had placed, I think it was $53 million in his proposed state budget. That number was whittled down to $19 million by legislative Republicans. I am hopeful that Governor Evers' original budget number will return in this next budget, especially since the state has so many funds available, and that we can really make sure that addressing mental health problems at a young age a priority for Wisconsin. Personally, and I mentioned this earlier, having seen so many folks who came into the courthouse as a defendant suffering from experiencing mental illness and having mental health challenges, I think that that's a worthwhile investment that will assist them in not falling down. I don't want to add any stigma to mental health, because I don't believe that there should be a stigma with mental health. But I note that there are a lot of people who ultimately end up, when they have undiagnosed mental illnesses, often self-treating with drugs and alcohol, and that can often lead down a path towards more dangerous behaviors. And so we want to avoid that. We want to make sure that people are living clean, healthy lives, that they're able to succeed, and that they're able to move forward, because there are an awful lot of people who are able to succeed and live healthy lives with mental illnesses, and we should be able to get them the resources to do that.
Thank you. Our next question, Mr. McGuire, we'll start with you, and then Mr. Hipsch can follow. This relates to incarceration. There is a widespread issue of, at least in some cases, inappropriate incarceration of people living with mental illness. What is your view on the role of the state legislature in reducing unnecessary incarceration of people living with mental illness? And do you propose or support any state initiatives to lessen the likelihood of people with mental illness entering the criminal justice system, often primarily due to untreated mental illness?
Well, I certainly do. As I've mentioned several times, this is something that I witnessed firsthand, and something I think that we can really make simple, straightforward efforts to help curb and to make significantly better. And so the best example I can give is earlier this session, I introduced, with Attorney General Josh Call, we introduced the Safer Wisconsin package, which was a $115 million public safety investment. And now that investment went along a number of ways. Some of the money is to recruit and retain police officers. Some of the money is to help support victims of crime. So I've worked closely with many of them over time, and I know that they need additional services. But one of the changes that we placed in there was to allow the treatment alternative and diversions funding that the state provides, to allow that to be used to help develop veterans courts and mental health courts. Now, both veterans courts and mental health courts can assist folks who are experiencing mental health crises or have experienced them, and it led them into a circumstance in which they could potentially be charged with a crime. And this would be one way, especially for low-level offenses, this could be one way that we take people who would otherwise live crime-free lives and help them avoid incarceration, while also getting them the treatment and the support that they need. So it's something I certainly support. I think mental health courts can do a great deal of good. And I'm disappointed by the fact that while this has been proposed multiple times, it has yet to move forward in the legislature to allow those treatment alternative and diversion dollars, which we're already allocating throughout the state, to allow those to go to mental health courts and also to veterans courts, where people experiencing PTSD can get the care that they need. I know Racine County has a veterans court, and it's seen some great success. I've been to some of the graduations. And I know it sort of covers southeastern Wisconsin region. I think so. We send some folks up from Kenosha County to be part of that court as well. But there are counties that don't have that and that don't have access to those kinds of programs. And so I'm hopeful that we can make that more universal and help folks who are experiencing some of these challenges.
Thank you. Mr. Hebsch?
Yeah, there's no question there are people who are incarcerated who are merely suffering from mental illness, and it just got mixed in with some bad behavior that got them in there to begin with. Again, we need to apply more, better diagnostic techniques and have trained professionals that can really assess these individuals before they're really locked up for good. I mean, they just need to understand kind of where the behavior came from. If it is simply a mental illness that's treatable, we need to get them the services that they need, and just not get them all in our jails, but get them back to get them in a program to deal with their illness and get them back, back living their lives. I think that would probably be one of the best things we can direct resources to, and funding and training individuals to do that early on when people are arrested, and really assess whether it is a mental health illness case or not, and deal with it appropriately.
Thank you. Mr. Hebsch, we'll start with you with the next question. And this relates to insurance coverages and Medicaid. Currently, insurance, at least in some cases, does not cover mental illness as comprehensively as physical illness. What can the legislature do to increase affordability for mental health treatment and coverage? And specifically, would you support increasing Medicaid reimbursement rates for mental health services?
So I've dealt with this personally. My wife's business, she's an acupuncturist, and some insurance companies will cover acupuncture services in full. Others will not touch it at all. And I think the same thing is happening with the mental health services. It's a need that needs to be addressed. And if one person is going to use more of their insurance coverage on medical issues and somebody else is going to use more of it on mental health issues, so be it. I think everybody should be on the same plane as far as how much coverage they get for each type of service. I don't think they should differentiate so much and have limitations on specializations like acupuncture and like mental health services, because again, that's really key to getting them diagnosed and getting treatment before they do end up with some other serious medical issue down the road. And I would think we can work with the insurance companies to try to bridge that gap and find some common ground where they can accept more coverage for mental health reasons.
Thank you. Representative McGuire?
Yeah, so I think it's important that we do make sure that we're increasing the coverage of mental health care in Wisconsin, especially since it's one of those things that it directly impacts so many other facets of somebody's life, and it is certainly something that could prevent people from being able to move forward and succeed with their lives, be able to hold down a steady job or things like that, and be able to move forward with their life. I'll say when it comes to Medicaid reimbursement rates, that unfortunately we have not been increasing Medicaid reimbursement rates across many sectors at rates in which they frankly should be. We do want doctors and dentists and mental health counselors and others to be able to cover the people in our community who are receiving Medicaid. And so increasing reimbursement rates, I think would incentivize more coverage, and it would allow more of these organizations to be able to take those kinds of cases. But also it would make sure that people are getting the treatment that they need and can move forward their lives, which is what we really want.
Thank you. Mr. McGuire, we'll start with you on this question and then to Mr. Hebsch. This relates to public education and stigma. While there have been significant improvements in public awareness and understanding of mental illness in recent decades, discrimination against people living with mental illness is still common. In your view, what is the role for state legislators in ending stigma and discrimination unfairly related to mental illness and mental health conditions?
Well, so I think that there are both formal methods for state legislators and informal methods for state legislators to assist in ending stigma and discrimination related to mental illness. And so I think one of the ways in which we can informally assist with that is I'm always pleased to speak about my experience with Kenosha NAMI and about the wonderful people who are working hard to deal with their mental health and move forward. And I think that we should feel comfortable talking about these problems and letting people know that this is something that so many people live with, that does not disqualify or mean that people can't live full, rich lives or anything like that. That in fact, there's a huge proportion of the population that lives with mental health challenges and experiences those things. And so we should feel comfortable talking about that. I'll also say, it's important when we also, the actions that we take. I guess the simplest way I'll say this is budgets are a reflection of our priorities and our understanding of the world around us. And so when we have money to budget, when we're putting together our budget and we aren't prioritizing mental health care, it is saying that it is either a problem that is unseen or hidden, or that we aren't prioritizing it, we don't find it important. And so while I'm very disappointed by the failures to increase mental health care for students in this past budget, something that I think is incredibly important and can not only destigmatize, but also provide people the healthcare that they need moving forward. I am hopeful. I am hopeful that we can start to do these things, that we can make sure that this isn't something that we continue to stigmatize or that others do as well. So thank you.
Thank you. Mr. Hipsch?
Yeah, it's very unfortunate that there still is a stigma attached to mental illness. And I think that comes from a lack of education and misunderstanding. I think there's a lot we can do publicly to educate the public about mental health, and that it is fairly common, in that, people do get treatment and go on to live normal lives. I don't know what the specific solution is, but I think there's much more we can do from a public information standpoint to just let people know, what some of the numbers are, and that there's probably more people dealing with mental illness than anybody knows. Like your example of, almost half of school age children have some sort of mental issue at that age. And, that's about half the population there. So I think if we actually just, use statistics like that to kind of normalize what's going on, I think people would be more accepting and realize that, they probably know more people with mental illnesses than they ever realized. So I think we can do a great deal of public education. I think we can do it without a great amount of cost. Quite honestly, it's just something we need to take initiative on and just push forward and educate the public, basically.
Thank you. And thank you, gentlemen, both for responding to our prepared questions. We appreciate your input and insights and perspectives. So we've now reached the portion of our forum where we'll give you each an opportunity for some closing remarks. And we'll start with Mr. Hipsch and then Representative McGuire to follow.
So now being in the legislature, I don't have a lot of the firsthand experiences that my opponent does, and I applaud him for his knowledge on the subject. I'm looking forward to getting in and learning more myself. But I think, there is a lot of way to go. There's a lot we can do. And it doesn't all have to cost a lot of money. We just need to apply the right resources, get people trained in different diagnostic techniques, and really get a great public awareness going of potential mental health issues, and just diagnose them soon and get people into treatment programs. And like I said before, normalize that process. So there is no stigma to it. And somehow we just need to move those issues forward.
Thank you. Representative McGuire.
Well, and thank you, Pat, and thank you for having this, and thank you, Ed, for being here. In my time in the legislature, I have prioritized mental health care, and in part based on my experiences as an assistant district attorney and a prosecutor, as well as my experiences with the Kenosha County NAMI. I think that, first of all, NAMI is a wonderful organization that does a tremendous amount for our community. And so I thank you and the viewers for their participation in your organization. But I also just want to say, there's a lot of good things that we can do to make this issue better and to help out the people who need it. And some of those have already been brought up tonight. We can expand treatment alternatives and diversions to include mental health courts and veterans courts. We can make sure that we're investing in mental health care in our schools. We can ensure that people who are on Medicaid have access to mental health services. And then we can make it easier for workers, mental health counselors and mental health care workers to be able to get their license and be credentialed for insurance, and so they can start receiving patients and treating people. I think those are simple things that can go a long way to making this less of a challenge for people and maybe an easier process for them to get some healing and for them to move forward their lives. I've been very proud, like I said, to have prioritized this in my time in the legislature. It's something that's near and dear to my heart. It's something I think that is very important to our community. It's something that's important to allowing our children to succeed in the long term, as well as making sure that we have safe and healthy neighborhoods. And so I'm committed to doing it again over the next 2 years.
Well, again, thank you both on behalf of Anami Racine County. As I mentioned, our discussion will be available on our YouTube channel, and we'll also be publicizing this to our supporters and members through our e-newsletter, which will be sent next week. And again, thank you both for your time and your insights, and have a pleasant evening.
My pleasure. Thanks, Pat.
Thank you.
Thank you, Pat. Appreciate it.
Thank you. Hope you